official publication of the NIH Virology 15 years ago showed that chloroquine, we use hydroxychloroquine, it's the same, a little safer, works. They proved this 15 years ago when we got this novel coronavirus, which is not that novel. It's 78% similar to the prior version, the COVID-1. Not surprisingly, it works. I'm now going to introduce our next speaker. Sorry, I forgot to say your name.
That's all right. Dr. Dan Erickson. Dr. Gold asked me to talk about the lockdowns, how effective they were, and do they cause anything non-financial? They always talk about the financial, but you have to realize that lockdowns, we haven't taken a $21 trillion economy and locked it down. So when you lock it down, it causes public health issues. Our suicide hotlines are up 600%. Our spousal abuse, different areas of alcoholism are all on the rise. These are public health problems from a financial lockdown. So we have to be clear on that fact that it's not like you just lock it down and have consequences to people's jobs. They also have consequences, health consequences at home. So we're talking about having a little more of a measured approach, a consistent approach. If we have another spike, coming in cold and flu season, let's do something that's sustainable. What's sustainable? Well, we can socially distance and wear some masks, but we can also open the schools and open businesses. So this measured approach I'm talking about isn't made up. It's going on in Sweden, and their deaths are about 564 per million. UK full lockdown, 600 deaths per million. So we're seeing that the lockdowns aren't decreasing significantly the amount of deaths per million. Some of their Nordic neighbors have less deaths for a variety of reasons I don't have time to go into today. So what my quick message here in a minute or two is just that we need to take an approach that's sustainable. A sustainable approach is slowing things down, opening up schools, opening up businesses, and then we can allow the people to have their independence and their personal responsibility to choose to wear masks and socially distance, as opposed to putting edicts on them, controlling them. Let's empower them with data and let them study what other countries have done and make their own decision. That's what I'd like to share. Thank you.
Are there any questions?
Who are you guys? We are so excited. I'm from South Dakota. You might have.
Yes. Yeah. So
I'm so glad you guys are preaching this message.
South Dakota did something interesting. It's interesting that you're from there. So the governor did not restrict access to hydroxychloroquine.
We know. We took
Right.
a lot of flack for that.
Right. And I believe you were the only state in the union that did that. And there's been studies out there that attempt to show that it doesn't work. They're inaccurate because they're given at the wrong time, the wrong dose, the wrong patient, either too much or at the wrong time. So South Dakota did better because it had access to hydroxychloroquine. Thank you so much.
Okay, so if someone we love does get sick with COVID, and you said that the hydrochlor, whatever how you say it, is restricted, how do we get access to that?
That's the number one question we're all asked every day. I want you to know that you're not alone. I've had many congressmen ask me, how can I get it? So if the congressman can't get it, it's tough luck for the average American Joe getting it. It's very difficult. You have to overcome a few hurdles. Your doctor has to have read the science with a critical eye and have eliminated the junk science. Many studies have been retracted, as you know. And number two, the pharmacist has to not restrict it. Many states have empowered their pharmacists to not honor physician prescription. That's never happened before. That interference with the doctor-patient relationship, where the patient talks to the doctor honestly and the doctor answers the patient honestly, has been violated. So you have a very difficult time as the average American. Some of the information we'll share later this afternoon is to show the mortality rates in countries where it's not restricted and the mortality rates where it is restricted. So I have friends all over the world now because of this. And in Indonesia, you can just buy it over the counter. It's in the vitamin section. And I'm here to tell the American people that you can buy it over the counter in Iran because the leaders in Iran, the mullahs in Iran, think that they should have more freedom than Americans. I have a problem with that. My colleagues have problems with that. We don't like to watch patients die.
But what do you think? If people have problems, they should should be picking up the phone. They should be calling their state and their federal representatives and senators and say, we are the American people, and we demand
Let me say one thing.
So you guys need the public to be
Right.
Thank you, Julie. That is exactly right. If you hear when you hear this, if you're concerned and wondering why you may not be able to get access to it, we need you to make 4 calls. Call your governor, call both of your senators, and call your congressman. And tell them that you want to know why you're not able to get access to a drug that doctors are telling you will help end this and help us reduce the number of hospitalizations and reduce the number of deaths. Urge them to read Dr. Harvey Rish's study from Yale. He's a Yale professor of epidemiology, and from there you'll find other studies.
Yes.
I want to ask, how do people trust the data that they're looking at every day? The numbers are so variable, whether you go to Johns Hopkins, CDC, which divides COVID deaths in different categories, whether it's related
Yeah,
to
but the numbers have
pneumonia,
plateaued now
other
that
things.
they're in control
So
of the number.
how do we get the right information to make decisions?
So the only number that I think is worth paying any attention to, and even that number is not so helpful, but is mortality, because that's a hard and fast number. So the case number is almost irrelevant. And that's because there's a lot of inaccuracies with the testing. And also, even if the test is accurate, most people are asymptomatic or mildly symptomatic. So it's not that important to know. So the case number, which you see rising all the time in the news, is basically irrelevant. And if you had told us a few months ago that that was the number that the media was going to go crazy over, we all would have just laughed at that. I mean, that's essentially herd immunity. There's lots of people out there who have tested positive without symptoms or with very mild symptoms. So the only number that's worth paying attention to is mortality. When you look at the mortality, this is a disease that unfortunately kills our most frail members of society. People with multiple comorbid conditions, specifically diabetes, obesity is a big one. We don't talk about that, but it is. It's a fact. Coronary artery disease, severe coronary artery disease, people like that. And also, if you're older, it's a risk factor. But the biggest risk factor is if you have comorbid conditions. If you're young and healthy, you're going to recover. If you're under 60 with no comorbid conditions, it's less deadly than influenza. This seems to come as great news to Americans because this is not what you're being told. I would say the answer is it's very difficult to get accurate numbers.
This is Matt Purdy of Breitbart News. If you had a message to Dr. Anthony Fauci, what would you say to him?
Listen to the doctors.
We-
Listen to the frontline
Yeah.
doctors. Have a meeting with the frontline doctors. And maybe I need to say that into the microphone. My message to Dr. Anthony Fauci is to have a meeting with these frontline doctors who are seeing real patients. They're touching human skin. They're looking people in the eye. They're diagnosing them, and they're helping them beat the virus. They're the ones who are talking to the patients. Have meetings with them and do it every single day and find out what they are learning about the virus firsthand. And it's important to understand, we have doctors here who are not emergency room doctors. They're preventing patients from even hitting the emergency room. So if they're only listening to emergency room or ICU at the very tragic end of a person's life, they're not getting the full story. They need to come back and hear the earlier portion, and they also need to understand what the lockdowns and the fears are doing to patients around this country, because there are a lot of unintended consequences which the doctors can speak about.
Let me say something. My message to Dr. Anthony Fauci is, when is the last time you put a stethoscope on a patient? That when you start seeing patients like we see on a daily basis, you will understand the frustration that we feel. And you need to start feeling for American people like we, the frontline doctors, feel. And you need to start realizing that they are listening to you. And if they are going to listen to you, you got to give them a message of hope. You got to give them a message that goes with what you already know, that hydroxychloroquine works.
I actually have a question for Dr. Warrior.
Dr. Emanuel.
Dr. Emanuel, you mentioned before some remarkable results that you've had treating your own patients. You said, I believe, over 300 patients that you take care of.
Yes, sir.
Have you been able to publish your findings and results from those patients?
We're working on publishing it right now. We're working on that. But this is what I'll say. People like doctors tell me all the time, publish the data. And my question is, and that will make you see patients? There's enough data around the world. Yes, my data will come out. When that comes out, that's great. But right now, people are dying. So my data is not important for you to see patients. I'm saying that to my colleagues out there that talk about data.
May I just interject? There is a lot
There's a lot of
published
data out there.
on this. Not every clinician needs to publish their
The
data
data,
to be
yes.
taken seriously. The media has not covered it. There is a ton. I've got a compendium on AmericasFrontlineDoctors.com.
Yep.
There is a compendium of all the studies that work with hydroxychloroquine. The mortality rate was published in Detroit less than a month. It was July 4th weekend they published it. Mortality by half in the critically ill patients. The patients who get it early. It's been estimated that 1/2 to 3/4 of those patients wouldn't be dead. We're talking 70,000 to 100,000 patients would still be alive if we had followed this policy. There's plenty of published data. I'm sorry
Even
that
with
it's not
Dr.
out
Rich.
there.
Dr. Rich published data recently, so there's a lot of data out there. They don't need mine to make those decisions.
If I can ask one more question.
Yeah.
There was a little girl who just a few days ago was 9 years old, otherwise healthy, and it was reported that she died of COVID-19. So I was curious, as from your perspective, do you feel that this little girl possibly died from some other condition that was wrongly attributed to COVID-19, or is there some other reason why she would have died from
speculate.
COVID-19?
I will not be able to say that till I look at the little girl's literature, the little girl's history and whatever happened. I know I've taken care of a lot of family members and I see a lot of children and they usually get mild symptoms, but I cannot talk about a case that I've not looked at.
Let me show you. What was the age of the child again?
She was 9 years old.
Okay, so listen, there are children who are dying of this infection. And the reality is that when they do die, they seem to have comorbidities. Really, you have to kind of look at each individual case uniquely. There have been a little over 30 patients in the entire country in the age category of 15 and below who have died of COVID. Frequently, they do have comorbidities like heart disease, they have asthma, they have other pulmonary issues. So I don't know. We don't know the answer to this 9-year-old girl. Tragically, she passed and she's no longer with us. But there's probably, if you dig into it, there's probably a story behind it.
Dr. Hamilton, have you seen any patients who are having adverse side effects because schools have been closed with depression or suicide?
I mean, I think that is